Patients who come in for facial rejuvenation can come in for a variety of reasons. Because the face is quite a complex structure, there are different areas that people have different concerns about. Broadly speaking, they're divided into the upper and lower eyelids and then the face and neck. There are other areas as well, like the brow. But the patient comes in, and again, basically, it's all down to the history. We have to listen to the patient first. What is it that they're concerned about? What is it that's driving them to sit in that chair and come and see, which is obviously quite a big and sort of like frightening step for anybody to undertake. So for me, the first thing and the most important thing really is to listen to what the patient says, hear what their wants, what their worries are, what the problem is causing in their life, how's it affecting them. Something I am a really big believer in is 3D visual technology, and I've got a 3D system. So it enables me to take a fully functional 3D representation of the patient, which we can examine together on a computer screen, so it avoids the whole standing in front of the mirror, them trying to point at something and me trying to point at something. We can actually look at it together on the screen, blow it up, shrink it down. It's a really useful communication tool. So after that, we'll have generally established a plan of attack of what we're going to do in order to address their problem. And as part of that, we go through the risks and complications of what the procedure involves, and also basically what the limitations of the procedure are, because everything is about expectation management. The body is an amazing organism, but it can't work miracles, and there are some things that you can't do, and you can't change the underlying bony structure, you can't change the underlying muscle pattern. You can't make someone look like Tom Cruise. You know, the stuff in movies is just not possible. But what you can do is identify the areas where you can make an improvement and express to the patient, this is what's achievable, this is what isn't. And then they can make an informed choice, a really informed decision as to whether or not they decide surgery is for them. Patients are very, very well educated these days. Everybody looks on Google, looks on YouTube, and they have a fairly good idea of what the problem is, though some of the nuances obviously won't be available to them. I would say probably about a half to 2/3 of the patients come in with a problem rather than a solution, and about a third of the patients come in with a solution, and then you've got to find out whether their solution actually fits their problem. And so there's always a bit of give and take in there. The lovely thing about Circle Bath is that it has a structure to it. We have a really good cosmetic surgery nurse specialist who is the focus of the unit, looks after all the patients, knows what's going on when and where, and actually is able to coordinate patient care. So the patients have a journey which is looked after at every step of their way, which is pretty unique actually for compared to other hospitals. The other nice thing about the environment in Circle Bath is because it's a team of surgeons, actually there are multiple resources available to you, and if there's a particularly difficult problem, you can discuss it with colleagues, or if it's not something you do, you can pass it on to the appropriate person. The team sort of like pulls together for learning experiences, and also we are having a sort of group discussion relating to problems and an audit. So basically it's very much a sort of cohesive structure that's modelled along the MDT process that one has for example, cancer treatment or the management of massive weight loss or something like that, where you get sort of holistic care all the way around, not just from one isolated individual. So it's a circle of treatment, if you like. So when patients attend for follow-ups, particularly in the field of facial rejuvenation, what's lovely is that they often have a smile on their face because they're able to tell you things have changed and their friends don't know how. That's the usual way it goes. And they've got a smile on their face saying, I saw X or Y today, and they said, oh my goodness, you look well. And often the response is, oh yes, I've been away on holiday, or I've done something for the weekend or something like that. So they never usually let on. But you know, it's their eyes look brighter because they've had an upper lid blepharoplasty, or their jowls have been tightened because they've had a mini facelift or a neck lift or whatever. And it's not having something that shouts, I've had surgery, but it's something that makes you look fresher and makes them feel better. And they come in and they say, nobody says I look tired anymore. Everybody says I look well. I wish I'd done this years ago. And that's a great feeling to have as a surgeon, because basically you've made a really positive change in their life.